ॲम्ब्युलन्स आहे आणि 102 पण ॲम्ब्युलन्स आहे, फक्त डॉक्टर नाही त्याच्यात. मग साधी ॲम्ब्युलन्स फक्त पाहिजे डिलिव्हरीला, कशाला 102? पण डॉक्टर साहेब तुम्हाला जर गाडी लागत असेल तर कम्युनिटीला सांगायचं 108ला फोन करा, डॉक्टर पण मिळेल, गाडी पण मिळेल आणि सगळं इमर्जन्सीचं साहित्य असतं. तर अशा प्रकारचे 3-4 गोष्टी आहेत कम्युनिटीला. आणि लास्टली एखादं सिरियस पेशंट आहे माझ्या सिव्हिल हॉस्पिटल किंवा तालुक्याला किंवा मेडिकल कॉलेजमध्ये ट्रीट होऊ शकत नसेल तर आपलं महात्मा फुले जन आरोग्य योजना आणि प्रधानमंत्री जन आरोग्य योजना हे 2 आहेत, तिथं रेफरल करा. तर तुम्हाला प्रत्येक एरियामधले लाईन लिस्टिंग तुमच्या वॉर्डमध्ये ठेवा की कुठले प्रायव्हेटचे आहेत कार्डिओलॉजिस्ट किंवा कुठले आहेत तुमचे वेगवेगळे हॉस्पिटल्स, तिथं तुम्ही सिरियस कार्डियक कॅन्सरचे पेशंट्स वगैरे आपण रेफर करू शकतो. तर हे 2 आहे. आणि लास्टली मंडळी, जे मेडिकल कॉलेजमधून तुमच्या डिस्चार्ज पेशंट होतात त्यांना इथून पुढे नवीन प्लॅटफॉर्म निघालेला आहे IT चं, दॅट इज ई संजीवनी OPD. तर ई संजीवनी OPD तुम्ही esanjeevani.com डाउनलोड करून घ्या ॲप, आणि ॲप डाउनलोड केल्यानंतर रेल्वे स्टेशनचा फॉर्म भरल्यासारखं नाव गाव आणि कुठला आहे काय ते तुमचं काय तक्रार टाकली तर तुमचं ते डॉक्टर सगळीकडे तुम्हाला महाराष्ट्रातले बसलेले दिसतील. सकाळी 10 ते 5 ऑलमोस्ट 200-300 डॉक्टर्स असतात बसलेले, आणि हे डॉक्टर तुम्हाला पेशंटला सल्ला देऊन प्रिस्क्रिप्शन पण देतात. ते ऑनलाईन प्रिस्क्रिप्शन येतं आणि हे प्रिस्क्रिप्शन मग घराचे म्हातारा कोतारा किंवा बाकीचे माणसं आहेत, फॉलोअपचे पेशंट्स आहेत, सायकोलॉजीचे पेशंट्स आहेत, HIV एड्स TBचे फॉलोअपचे पेशंट्स आहेत, हे त्यांना आपण त्या माध्यमातून कव्हर करू शकतो. तर अशा पद्धतीने ई संजीवनी OPD सगळे ॲडमिटेड पेशंटला शिकवून टाका वॉर्डमध्ये, म्हणजे फॉलोअपचा लोड तुमचा मेडिकल कॉलेजचा कमी होईल, अननेसेसरीली पेशंट्स येणार नाही. आणि लास्टली आम्ही टेलिकन्सल्टेशनला 300 रुपये मेडिकल कॉलेजच्या टीचरला देतोय. तुम्ही जर माझ्या एखाद्या मॅटर्नल चाइल्ड किंवा स्पेशालिटीला पेशंटला सल्ला दिला खालून तर आम्ही मेडिकल कॉलेजला त्यांचा सल्ला घेतला पाहिजे. तर म्हणून आम्ही पायलट प्रोजेक्ट म्हणून 5 प्रायव्हेट डॉक्टर्सना पण दिलाय की तुम्ही तुमच्या प्रायव्हेट क्लिनिकमधनं मला सल्ला द्या, तुम्हाला आम्ही 300 रुपये मानधन पर पेशंटला, जिथून तुम्ही आम्हाला मार्गदर्शन कराल माझ्या पेशंटला तर ते होईल. तर ही सुपर स्पेशालिटी आमच्याकडे फॅसिलिटीज नाही आहेत, आम्ही डेव्हलप करतोय. मग आता थ्रू ई संजीवनी OPD आणि थ्रू टेलिकन्सल्टेशन आपण हे करत आहोत किंवा प्रधानमंत्री जन आरोग्य योजनेच्या माध्यमातून. तर मंडळी, तुमचा मी जास्त वेळ घेतला, परंतु वारंवार डायलॉग होत नसतो. सोप्या पद्धतीनं पुस्तकातला वेगळा डायलॉग असतो आणि थेरॉटिकल एक्सपिरियन्सचा मागील 35 वर्षाचा 14 जिल्ह्याचा घेतलेला अनुभव, असं मला असं वाटलं की तुम्ही अति उत्साही मंडळी आहात. आरोग्यदायी आरोग्य नगरी तुम्ही स्थापन केलेली आहे, तर तुम्हाला आरोग्यदायी ठेवावं आणि तुमची कम्युनिटी जर डॉक्टरची जर प्री मॅच्युअर काही प्रॉब्लेम नाही आले तर दॅन यू विल वर्क फॉर युअर फॅमिली आणि मग आपण सोसायटीला. तर अशा पद्धतीनं मग आपला घोषवाक्य आहे महाराष्ट्राचं, संकल्प निरोगी महाराष्ट्राचा, तर तेव्हाच आपलं साध्य होईल. आणि आता आपण पाहतोय की इंटरनॅशनल डे योगा पर्वाचं घोषवाक्य आहे काय, वसुदैव कुटुंबकम. ओके, म्हणजे 1 अर्थ 1 वर्ल्ड आणि 1 फ्युचर. तर ह्याच्यामध्ये जे 1 फॅमिली 1 वर्ल्ड जे आहे, 1 फ्युचर जे आहे ते आपल्याला जे 2014 पासून जे चालू झालं योगा डे, तर प्रत्येक आरोग्याशी निगडीत आहे. आपल्याला सगळ्यांना सांगणं आहे, फक्त थेअरी बोलू नका, दररोज सकाळी उठल्यानंतर 10-15 मिनटं तरी तुमच्या आरोग्यासाठी द्या, एवढंच मला तुम्हाला म्हणायचं आहे. तरच आपल्याला फिलिंग ऑफ वेलबिंग येईल. आणि रात्री लेट जागरण करू नका मंडळी, कितीही ताणतणाव काम असलं तर, पण रेस्ट द्या आणि मोबाईलपासून डिस्कनेक्ट व्हा रेस्ट देताना, नाही तर मोबाईल चालू ठेवून पॉसिबल नाही आहे. ओके, थँक्यू सर. थँक्यू.
Dr. Sudhir Deshmukh sir to felicitate Dr. Vikas Mahatme sir. Yes, and from past many years he has been the former member of the Rajya Sabha. As we all know, the practice of medicine is a unique passion, as unlike other practices, in the practice of medicine, a life serves a life.
Many times in my career, I have realized that the man I am talking to is probably more experienced, has better technique and better expertise than me in his own field. He's probably a better surgeon, but he has not got the opportunity or probably the luck to sit in a good opportune kind of a chair. So that is something which we all must understand, and that will keep our feet absolutely on the ground. It doesn't matter where your head goes, your feet have to be planted on ground. I think Mahale साहेबांनी तेच सांगितलं आज की तुम्ही काय पाहिजे ते करा, पण तुम्हाला तुमचे पाय जमिनीवर पाहिजेत. हे फारच मोठी गोष्ट त्यांनी सांगितली. Making of the surgeon, how I've been a consultant for the last 41 years, and I'm a cancer surgeon, I'm an entrepreneur because we run a chain of cancer hospitals. So how exactly did I reach it? I will actually sit here because I need to change the slides fast. So okay, if you really analyze, आपण history जर बघायला गेलो तर before 600 BC, Shushruti era was the first surgical era, but not much is really available, and cancer was called as Arbud Rog that time, and there were multiple treatment modalities which are explained by Shushruti. Unfortunately, nothing is written about that, and then all thing is forgotten. In 1600s, Galen actually said that because of humors, which is like bad mood, cancer occurs, but again, nothing really scientific. The whole thing is actually has happened in last 200 years. So the modern medicine, in the late 1800s, the understanding of techniques of surgery. In the phase 2 was understanding the biology of disease, so it means that only surgery is not going to be really adequate. Third one is the development of associated specialties like radiotherapy in the 1900s, chemotherapy in the mid-1900s, genetic therapy in 2000, and immunotherapy thereafter. And phase 4 is what is transforming technique to technology. Now you will see that what the advances of technology, what you see in ophthalmology, in orthopedics, and every kind of so this thing has happened even in cancer in the form of robotics, fantastic ICUs, molecular diagnostics and genetic therapy, and everything is really making a difference. What makes for excellence in surgery? Now, please understand one thing, you can't plan to become a successful surgeon or plan to become a master excellent surgeon. You have to do the right thing at the right time, follow multiple kinds of steps at every time. You can't really plan, मी 30 वर्षानंतर most successful surgeon in Maharashtra किंवा इंडियामध्ये होईल. You can't have an aim like that. It's not an achievable thing. You can't say, I will become Ratan Tata, I will become Narayan Murthy. Not achievable. Please understand. But you have your target setting maybe for 3 years, 5 years. जसं आता महाले साहेबांनी सांगितलं की have short aims, keep yourself healthy and try to part other people with good health, and that is exactly what makes for excellence in every field. So I would very strongly suggest to you a book called Malcolm Gladwell's with post-graduation. Some may actually start your family practice, some may actually leave and go into management, some people may go into UPSC and try to, you may control all the entire group by being a collector or an IPS officer or something, a minister someday, so something like that. But understand one thing, that you have to acquire a new skill every year. It could be anything, completely unrelated. You may go learn shorthand, you may go learn music. Put all those dots in various places. Someday in your life, the dots will all connect. It will just make you a better human being, better person. And have a hobby. Ultimately, when you are going to retire, someday you are going to retire, and then you should not be left sucking your thumb. So my course was, I did my graduation from KMC Hubli in 1976. Then I did my post-graduation from TMH in 1982, further training at various hospitals, Mumbai, abroad, then first consultancy post in Bangalore, Kidwai Cancer Center, then worked in Tata Memorial Hospital for almost about 18 years, and I withdrew as the chief of surgical team there, and then we started the Asian Cancer Institute. Cancer is something which is known from thousands of years. It's been there in the records of Shushusha as well as from Egyptian mummies. It's also known in the animals. So there is nothing new about it. But why does it really bother us? Because it causes a lot of suffering. Last year there were almost about 14 lakh new cancer patients which were diagnosed, and that number is just going on increasing. It is said that in the next 10 years, this number of 14 lakhs is going to go to 25 lakhs. 1 in 130, out of 1 lakh people, 131 people get cancer every year in India. The same number in America is about 495, almost 4 times, nearly 4 times. But we want to become like America, develop like America. So which means that even your diseases problem also is going to go, and that is going to get higher and higher. Different types of cancers are there. The cancers which are seen abroad are completely different. Here there are prostate and lung and esophagus, head and neck are the common ones. In case of women, it still is breast, cervix, lung, esophagus and others. Geographically also they change. Now, just one example I'll give you. Dr. Male already mentioned about tobacco, the scourge. If you remove tobacco completely from our country, make it vanish, 30% of cancer will vanish, which means that out of 14 lakhs, 5 lakh cancers will just disappear. There are almost more than 15 different types of cancers which occur directly because of tobacco. Head and neck cancer as a group is the commonest registered cancer, 26% in most of the cancer hospitals all over the country except in Goa. Goa has built a very vibrant program against tobacco, and there it is only 11%. So it just goes to show that what can be achieved if you remove tobacco from the circulation. Different locations will have different types of cancers. Abroad, actually, the incidence because of death because of cancer is coming down, but it is not happening in India. Why do we really treat cancer? Because if you don't treat cancer, it will 100% kill, and that's the reason why we treat cancer. You can see here that this is something which is one of the common cancers what we see. There are different types of cancers which are some diagnosed when they become very obvious, some diagnosed when you are undergoing a preventive kind of a checkup. You can see here that there is a calcification. The whitish patch what you are seeing on a mammogram is the cancer there, and that can easily be diagnosed by just doing a biopsy. But so many times it is just not diagnosed because people are not aware. So public education is something very important. Preventive mechanism is very important. Advanced kind of imaging, for example, a two-dimensional mammogram for very, very small lesions like what we diagnosed it in a non-palpable kind of a manner. You can actually do a cryo-freeze, you could do a radio frequency ablation, you could do microwave ablation and achieve the same kind of a result. We are seeing here that transarterial embolization. There is a huge tumor in the liver, which this patient is not very fit for this surgery, but you can actually embolize, you can block that artery with supplies, and the patient will live for at least 2 to 3 years more. You could do this chemoembolization for liver tumors. You can see here that there is a large tumor. The whitish and the blackish thing is the huge tumor. You do a microembolization, and the whole thing is completely liquefied. This patient will live at least for 3 years more. Patient doesn't know that he has a tumor, but he comes with a large tumor in the liver, and he would have died within 3 or 4 months, but he's going to live for 3 more years. Most of these patients are there in their 40s and 50s when they're supporting their family, and you make them live for a few years more. You can understand how much of benefit that they will have. What is the next step of minimally invasive surgery? Robotic surgery. So there is a robo. I'm sitting here on my gantry and operating a patient there. You can see here, this is how it is going to work. Surgeon is sitting in one corner. He's seeing exactly the same thing through the telescopic vision of what is happening in the abdomen or in the under the neck or in the chest, and you can actually manipulate all the instruments sitting there. So multiple ports were introduced at that time earlier. Today you can do the same thing through a single port with peculiar instruments. You can see here, these are like the sci-fi movies, where that extraterrestrial being comes with funny kinds of hands and all that. You are actually able to see that. There's one fellow on the top. That eye is actually the scope, and the surgeon is actually watching through that. He has got these two. You can actually have one more, and you can actually do everything that is really required. So, and you can actually teach people. You can see here that there are 2 gantries. One is a surgeon, one is a student, and there is somebody, that image, somebody who is actually marking. So they are watching what is happening, and the person is marking, okay, here is the vessel. That person, the third person who is standing next to the screen, is marking on the screen, and that marking, the student will be able to see that area needs an additional attention. So there is a mentoring also which goes on. And advantage, you can see here that these are the only scars that this patient will have. Patient will go home in 3 days. Yes, it does cost money, but progress does cost money. That is what is important. Breast cancer from 1880s, from radical excision has gone to very totally conservative. Today our excision is, we identify tumors much smaller. The average yield, that is the size of tumor, about 30 years back used to be 4 centimeters. Today it's come down to about 2 centimeters. You take out only half a centimeter all around. Most breasts, more than 70% of the breast today can be salvaged, and rest of the breast can be radiated. If the tumor is large, you can give them chemotherapy, make them smaller, conserve the same breast with a good surgery. We try to avoid even doing a dissection in the armpit, because quite often in about 15% of patients it gives rise to arm swelling. So you can actually identify whether there is an involved node or not, which is called a sentinel node biopsy technique. You can give an injection like that. You can see that there is a colored node, so you can pick up that node. That will be the first node to metastasize. It's called a sentinel node. If that does not show metastasis, you don't have to do a dissection at all. You can see here the cryoablation was done for that particular tumor, and this whole area is actually sterilized. These are the advances of radiotherapy. This is the stereotactic radiation therapy, and this is an intraoperative radiation. You can see that the ball. So when you open that particular wound, actually you can radiate it at the same time. You have to know intraoperative radiation therapy. One sitting. You don't have to call the lady again and again for 15 days, 20 days. Somebody coming from Solapur to Mumbai for radiation therapy. Now you have radiation here also. But there used to be a time when they had to come to bigger cities, like go to Pune, go to elsewhere. You don't have to do that. You've done the surgery, you radiate it intraoperatively, and you are done with the radiation therapy. That's it. So that is exactly how it can work out. But that does not mean that radiation doesn't have side effects. You can have a little burn and all that, which can be treated by good creams. Then suppose we have there is a widespread disease inside the abdomen, like in the ovary. There is an intraperitoneal disease. You remove the entire intraperitoneum, and then you can do advanced chemotherapy technique, which is hyperthermic intraoperative chemotherapy at the temperature of about 45-46. You circulate saline with medicine in it, with the chemotherapy in it, at about 45-46 degrees centigrade, and the penetration of that drug into the tissue is almost up to 3 to 4 millimeters. So if at all there is disease in that, then you can actually kill that. This is a special equipment like that. So the technique to technology progress is very, very fast. You can actually improve the efficacy of resection also. Earlier what used to happen is you have taken out a part of the stomach. You don't know up to what level the lymph nodes are involved. So you can actually inject a dye called indocyanine green, and that will go to every lymph node which is likely to be involved. So you take out all those nodes where the dye spreads. So these are guided kind of targets which can actually be taken out. You can detect the genetic structure of the breast cancer and identify only that segment of patients which are likely to metastasize, and avoid chemotherapy in the rest of the patients. The venous access, we put a catheter there called Hickman catheter and port under the skin, and injections are given like this. You can see here, this port under the skin can be kept for 2 years, so you don't have to really inject in the peripheral vein, no swelling, no this thing. You can see that is the port, very easy to stick a needle and to treat that. But that doesn't mean that chemotherapy doesn't have toxicity. You can have multiple toxicities, but they all can be very well controlled by modern medicines today. So what then? The latest this thing is the genetic therapy success. You can see here that this was a patient, this was a nun who had come with operable lung cancer here. You can see that there's an operable lung cancer. But she also had a spread in the brain. That's a stage 4. Patient doesn't qualify for surgery. So she was given this targeted therapy, and now till 2022 she is completely out of the disease. So 9 years, stage 4 malignancy of the lung, and she's still alive and she's working very, very well. This is the kind of a thing which probably in the Middle Ages would have made me a saint. They would have called me to the church and made me a saint. So you can see here that this particular disease was, the patient was not operable, was treated by a targeted therapy, and you can see that it has become smaller. And it actually, the survivals in responders is definitely higher when you give treatment. You can see here that this is a stage 4 malignancy, bilateral lung, treated with appropriate medication, and patient is alive 2 years down the line. Same thing here also, you can see that this is a stage 4 malignancy, same patient 2 years down the line. So today what is happening is, what is the advance in oncology? If you can't cure a malignancy, make it chronic. You can't cure diabetes, hypertension, try to make it chronic. So that is exactly how we do. And the latest kid on the block is immunotherapy. Median survivals have increased from 9 to 19 months. There is a specific therapy called CAR T cell therapy. You can actually take out the tumor cell out, prepare its antigen, create antibodies to it, and put them into the body, and then you can actually cure that particular stage 4 malignancy. You can see there upper zone cancer, posterior zone cancer, everything completely cleared with immunotherapy. You can see a stage 4 malignancy of the breast which is spread inside. You can see multiple liver mets, everything completely cleared with immunotherapy. Then we also have cancer vaccines. Preventive vaccines are there, therapeutic vaccines are there. When you actually use a vaccine for hepatitis B, you are preventing liver cancer from occurring. There are prostatic cancer vaccines. There are colonic cancer vaccines which can actually improve the survivals. So what is the latest one is, we are looking at a universal cancer vaccine. Can you have just one vaccine which will prevent cancer from occurring? There is a lot of research, but there is no real-time progress. It's not still available. So medical oncology advances, cancer vaccines, targeted therapy, immunotherapy, lot of talk is going on. Now this is a better technology helping us by better diagnosis and prevention, better treatment facilities, better awareness, better mechanism, artificial intelligence for data analysis. The data is so much that human beings will find it very difficult to attend to that. So that is exactly how it happens. And what will ultimately be scientific curiosity is, maybe someday we'll start growing organs. You have a cancer of the lung, cut the lung out, put another lung. It's like almost like a mechanic's job. Hopefully that will happen. But more than that, most cancers are because of genetic problems. So manipulate the genes themselves. So can you really cure them at that particular time? This is what we are seeing now. You know, as time goes, the cancer with immunotherapy is going to stay there, and genetic manipulation is going to stay there. Surgery is going to come down. Chemotherapy is going to go down further. So that is exactly what is going to happen. So next, this thing, what we are seeing is exactly like what I am saying is, better targeted therapies, better immunotherapy, more stress on cancer genetics, nanotechnology for medicine, robotic surgery will become absolutely routine. But all the while, work, and don't lose your balance between your work and motion and personal life. You know, don't take life too seriously, because nobody really does. Thank you.
Thank you so much, sir, for your inspiring words, and especially I really appreciate your efforts, and we express our sincere gratitude from our college towards you. Thank you so much.
We are really grateful for having you over here, sir. I request the Dean of our institute, Dr. Sudhir Deshmukh, sir, to please felicitate Dr. Deshpande, sir.
Thank you.
We also welcome the chairperson for today's conference, Dr. Savaskar ma'am. I request Dr. Dantakale ma'am to please welcome Dr. Savaskar ma'am. I request Dr. Hirak sir to please welcome Dr. Sarvade sir, Professor and Head of Department of Ophthalmology. Thank you, sir. It has been believed since a long back that a doctor's touch is no less than a God's touch. Well, looking at the dramatic scenario in past few decades, many of the talented doctors, through their extraordinary communication skills and through their wise perception, have established themselves as gods in the heart of the community. Practically every single day, some new innovation comes to fore, some new path-breaking study is published, or some new guideline is released. Paying tribute to such divine souls and their loyal service for the humankind, I would like to welcome Padma Shri Dr. Vikas Mahatme sir, an inspiring ophthalmologist, a former member of Rajya Sabha and founder and director of Mahatme Eye Bank and Hospital, Nagpur, to bless us all with his insightful words on building practice, win-win for doctor and community.
हाँ यस हाँ इथं आतमध्ये PPT घ्यायला सांगितलं डीन सर म्हणून आत थांबलो. हाँ कर.
Good afternoon. Good afternoon. Thank you. If you reciprocate, that will increase my energy. So please respond to everything. Thank you. It was a nice thing to be here in the medical college. I have attended so many conferences, ophthalmology conferences here, but it's a great experience to be part of the faculty now. And I'm very happy that the Dean, Dr. Deshmukh, Dr. Malay is here, Sode Madam is there, pathologist Madam is also there. Then Sarode, ophthalmologist, HOD. And Nishant, I don't know where he is, but he followed it up, and so I could come here. So thank you all the team which has organized this, what you call it, Hirak Mahotsav, that Diamond Jubilee. And I shall like to let us clap for those who have worked hard to make it successful. I feel very successful. My slides do have audio also, so it's better. The first slide. Yeah. I welcome you all for this lecture. You have offered me the bouquet. Similarly, I am offering you the visuals. Ophthalmologists always offer the visuals only. Then the topic next is the building practice. Can I have a stand or something? Okay. Building practice is a very important thing. And in a way, do you have a stand? So that I can have, okay, fine. It's okay. So building practice is very important. And in a way that will help the doctor as well as the community. That is very important. So what are the things which are required to build a practice? First is the knowledge. Next slide you can move it to. The knowledge is, everybody of you has a good knowledge. You have, all people will have very good knowledge. You are really bubbling with knowledge. And knowledge may be, many times I feel, better than those teachers or professors' knowledge, as far as knowledge is concerned. But it is very necessary to have knowledge. But it is not enough. It is necessary doesn't mean enough. Only knowledge is not enough. So, knowledge is necessary but not enough. So what are the other things which are required? In addition to that is the skill. We are nowadays much aware about the skill, and when I say skill, we always think of surgical or operational skills. But it's not true. Skills are of different types also. One is the skill counseling skill. Just now also Dr. Deshpande has already told, and Dr. Male also has repeatedly told. So skills are very important after knowledge. So just in brief I shall share my experience also. I was not able to swim, so to learn swimming was my target. So being a studious student, what I did, I went to the library, pick up the book, How to Swim. I understood all the concepts, and if anybody would have taken an examination, I would have got 100 out of 100 marks in theory, as well as Viva would say 200 out of 200. So I would be merit first. But now with that merit first certificate, if I jump in 20 feet deep water park, what will happen? A swimming pool. What will happen? I will not come up to read another book also. So what is that is needed? We feel that I am merit first. It is necessary but not enough. So what are the things which are required? What is the difference between the two? Skills require repetitions, practice, and that is very important. So counseling, we feel that, oh, I know the counseling, how to speak with the patient. But I tell you, my own experience, next slide. Own experience. When I was young, a cataract patient comes. Then it has that, okay, I have what the complaints and everything. I tell him that you have a cataract and you need operation. लेकिन वो बोलता है कि लेकिन मुझे तो दिखता है. I can see, I tell him, I can see that you have a cataract and you need operation. वो फिर से पूछता है, लेकिन गारंटी है क्या? तो मैं बोलता था जब यंग था, गारंटी तो मेरी नहीं, तुम्हारी कैसे लूँगा? मैं डॉक्टर हूँ या तुम डॉक्टर हो, कैटरैक्ट है, ऑपरेशन करो. But now I am experienced. The same patient if comes, I do the counseling. He says, मुझे तो दिखता है. Yes, what you say is correct. आपको दिखता है, लेकिन आप याद करो कि सामने से रात को लाइट आता है एक व्हीकल का, तो परेशानी होती है. हाँ, वो व्हीकल चलाना थोड़ा डिफिकल्ट है. रात को जब आप जाते हो स्टेयरकेस से, तो स्टेयर्स अंधेरा रहा तो दिखती नहीं है बराबर. हाँ, वो थोड़ा सा डिफिकल्ट तो रहता है. पहले एकदम आराम से उतरता था, गड्ढा दिखता नहीं रास्ते पर. That's why you need operation. But then he says, is there a guarantee? Because now I can see, and if that also goes away, what will happen? Is there a guarantee? But now I say, look, if you do not get operated and if you get operated, suppose you take a tablet, then there also can be some allergic reactions. I have seen few people death because of the tablets also. Injections, you must have noticed in the newspaper. If you cross the road, there is a risk. There is a risk. And similarly, if you ride on a vehicle on a road, there is a risk of accident. But we take that risk daily. So we are not much aware about it, or we do not think much about it. Similarly, there is some risk in the operation, but if you do not operate, there is more risk. Because when the vehicle comes, you are not able to see clearly, and you are moving on the two-wheeler. So there is a risk of accident. I have seen patients who delayed their operations and met with an accident while climbing down the stairs, while going down the stairs, or while driving the vehicles. So now I can counsel it in a better way, so that patient, in an appropriate scientific way, not telling untruth to the patient. So this is the skill. Skill needs empathy first. It is not because I want to earn, but it is because in the interest of the patient. The skills are very important, not as far as patients are concerned. Many skills are required. Team member. As a team member, you need skills. Alone you can work. You have worked in this as a team, organizing this program. But that is a skill. You will be better team when you practice it. क्रिकेट में प्रैक्टिस करते हैं कि नहीं करते हैं? बार बार प्रैक्टिस होती है एज ए टीम मेंबर. इंडिविजुअली दे डोंट थिंक, क्योंकि ऐसा नहीं होता है कि आखिरी में सिक्सर मारने जाऊंगा तो आउट हो जाऊंगा, लेकिन सिक्स यू हैव टू बिट, बिकॉज ऑन दी 2 balls are remaining and 8 runs are there, suppose he has to go for that. So that is there. The skills are required as a team member also. Thirdly, these two are, if you have, it is good. But third thing, very important, next is the attitude. Is the attitude you need. Attitude, I shall share my experience with you. Attitude, about the attitude. Suppose you are doing a practice. There were 2 doctors who were doing the private practice. And they decided, they were friends, and they decided that with family, tonight they will go for the dinner outside. And then to a hotel, a dhaba outside. And everybody dreamed that will be a beautiful night, because they will be going night with the family members, and the food is also delicious in the dhaba. But what happened? The first was the Vicky. A patient came at 9 o'clock when he was closing the doors of the clinic. Inside the mind he said, "Isko abhi aana tha." And then he treated that patient. Treated very well. He had a spectacle number, he gave it, and treatment was appropriate. And then he closed the door, and मन में ये सोच रहा था, आज ही देर हो गई, आज तो मुझे जल्दी जाना था. Patient कल भी आया रहता तो भी हुआ रहता. The other was Vivek. The same thing happened with him on the same day at 9 o'clock when he was closing the door of the clinic. Patient came. उसने सोचा, बहुत अच्छा हुआ, मैं यदि 1 मिनट पहले बंद करता था तो ये पेशेंट मेरा मिस हो जाता था. I would have missed this patient. 1 मिनट पहले मैं, अच्छा हुआ मैं यहाँ रुका था 9 बजे तक. And he treated in the same way, nothing different. He thought that it was good. In long run, whose practice will be better? What do you think, Vicky or a Vivek? Vivek. Yeah, everybody said unanimously. But when we work, हम कैसा करते हैं, अरे यार मुझे ही करना पड़ता, वो ना वो प्रोफेसर का नज़दीकी है, उसको नहीं करना पड़ता. If you are doing work with the background, you have to create happiness, what Male said every time. But so that is very important. That the attitude with what attitude you are doing. Everybody said hard work, but I also feel it's a hard work. But when you do it with interest, you don't feel. When you are, suppose there is a sport and you are playing, आपको perspiration हो रहा, respiration rate बहुत ज़्यादा है, थकान बहुत, यानी physically you are, but mentally you are very alert और प्रोत्साहित है. Is it not hard work? It is also hard work. But when you enjoy it, you don't feel like a hard work. So how to create enjoyment or happiness in the work is very important, and that is the attitude. If that attitude comes to you, of you, and then you will be able to achieve success in any field. That is what. And that is very important. What I always feel, what we want in life is never taught to us. मुझे बताइए, यहाँ पैसा अर्न करना है या नहीं है? सबको अर्न करना है कि नहीं चाहिए? पैसा नहीं चाहिए किसी को, चाहिए कि नहीं चाहिए? चाहिए. When I want to have money, I never learn about how to earn money. जब मुझे सर्जन होना है तो मैं MBBS से लेके 3 साल, वो कम से कम 10 साल 15 साल में प्रैक्टिस करता हूँ. But when I want money, I don't learn how to earn money. When I want happiness, Dr. Malay told so many times, happiness चाहिए कि नहीं चाहिए अपने को? चाहिए. Every time. Not a second we want to be unhappy. But it is never been taught. You feel that this cannot be taught. No, this can be taught. Attitude can be taught. Everything can be taught. And not only taught, it can be grasped and it can be developed. If you see the army people, do they work only for salary? जब युद्ध होगा, war होगा, they will be there on the front. Still they want money only? No. They are fighting for the country. They don't think that I shall die here. I don't want to be here. No. So they have been taught like that, nurtured like that. But this is not true for army only. This is true for medical professionals. Do you think that during Corona, there was a fear of death to the doctors also? But 90% doctors said, no, we will serve the patients. And they have served. But this has been come from not by teaching, but by seeing the seniors, following them. But it can be taught specifically. So, like surgery, like medical, all the things, this can also be taught, and this should be taught. This I shall tell you in Romania. Doctors had a strike that they said that we will not treat the corona patients. So that attitude was not there. But it was never a problem in India. Nobody thought of a strike that we will not go to the corona ward. Nobody thought of a strike. So this can be taught and this can be imbibed. Next. Yes, what I said, that we want to earn money, but not at the cost of ethics and moral values. That is very important. But this is possible. Why you people feel that earning money is bad? That I tell you, when you do unethically, when your moral values go down, then it is bad. Against rules and regulations of government, then it is bad. But if you earn ethically and morally, socially, the way it should be, it is more needed, much needed. Why I tell you? When you earn a lot, what will happen? You will say that you will pay the tax. With the tax, all the schemes, what Male told just now, Dr. Male, that are possible because the tax is paid to the government. Second, when you keep it in the bank or any share market or anywhere, that money is available for others to have a loan. Youths. So use it. When you earn, you give jobs to the people. So earning money is not bad. I want that country, India should be a rich country, whether you want it or not. No, anybody telling that I do not want that India should be a rich country? Everybody wants that India should be a rich country. But the people will be very poor, they will not be earning anything. Will that happen? Everybody has to be rich, then only India can be rich. It is not possible that the poor people are very poor and India is rich. That is not possible. It is only one part, but it is very important part. So, building a practice in that way, you should take it. I shall tell you, it will be win-win for both the patients as well as for the doctors. How we will see. Simple, different and better. We have to be simple, different and better. Something when you do practice, every time think of this thing. Simple. Is it different from what others are doing? And is it better? When you start a practice, suppose, you will think which is the service which is not available here. So, I will start with that service. So, you will get an edge over others. But you will think in terms of competition. But I tell you, you don't go for competition at all. Once you are a postgraduate student, forget about competition. Always think of a team. Always think of a cooperation. I shall tell one experience. We have a paramedical course. And in paramedical courses, we 12 pass students we take, ophthalmic technician course. And we take the interview and then they are selected for the course. So what happened, I started taking interview. Then the students number was very high, so at a time I called 2 students. There were 2 students and we got bored. They came from Nagpur only. So I asked them, just on a lighter tone, I asked them, यदि आपके पीछे कोई टाइगर या बाघ लगता है तो आप क्या करेंगे? पहले 2 गढ़चिरौली के विलेज से आए क्योंकि वहाँ टाइगर्स और बाकी चंद्रपुर और बाजू के मिस में हैं बहुत सारे. तो मैंने उनको पूछा जैसे क्योंकि वो चंद्रपुर और वहाँ टाइगर है, कैपिटल बोलते हैं महाराष्ट्र इंडिया की. तो मैंने जैसे पूछा आपके पीछे टाइगर लगेगा तो आप क्या करेंगे? तो दोनों बोले कि हम विल ट्राई टू फाइट अगेंस्ट द टाइगर, उसको मारेंगे, भगाएंगे की कोशिश करेंगे, ये करेंगे. मैंने बोला आप क्या उससे भी ताकतवर हो क्या? लेकिन उसको डराने की तो कोशिश करेंगे. बोले दोनों. फिर ये नागपुर वाला है, उनको पूछा तो उसमें से एक ने बताया, ये सेम क्वेश्चन पूछा उसको कि टाइगर आपके पीछे रहा तो आप क्या करेंगे? सेम क्वेश्चन. तो एक ने बताया मैं जोरों से भागूंगा. मैं बोला तुम क्या टाइगर से भी ज़्यादा जोर से भागोगे? तो उसने बताया नहीं, टाइगर से जोरों से भागने की कोई ज़रूरत नहीं, ये बाजू वाला इससे ज़्यादा जोर से भागा मैं तो बहुत हो गया. That is the competition. We do not want that. We want cooperation. So something different is a creativity. And when you are creative, never bother about competition. We always try to be creative. Something simple, different and better. Something simple, different and better. Always think of that. And there will not be fear of competition at all. Because you will be unique. Why till today also I shall say that you have to face the competition because you have to get good marks in your NEET exam also. That is the challenge. Otherwise, our teaching system is like that we give too much importance to competition as compared to cooperation. But in life, आप examination successfully pass कर सकते हो, but you will not be successful in life if you do not cooperate with each other. Competition will not take you successful in your life at all. Just something, because the environment created by us is not good for cooperation. That also I tell you. Because the topic was raised that you should see the patients. But we are somewhere, because the population number is very high, we are somewhere here that we create an environment which is healthy for competition, which promotes competition, not healthy, which promotes competition. I tell you, I asked one of my friends that you should see the patient, same advice as every adult. He said, I'm okay with your advice, but will you pay the fees for the private medical college, which is in crores, or even I may not get admission in any medical college for my post-graduation. Because if I see the patient for 4 hours or 3 hours only, and half an hour to go and half an hour to come back. So 4 hours, others are studying for 12 to 15 hours, I shall study for 8 to 10 hours. So they will get good marks and I shall not get good marks. So who will bear that brunt? So I don't say it to you because I am a very practical person. I never tell a thing which will be harmful to you. But you should know the limit of that also. Okay, we cannot change the system. But now for 3 years it's okay. But afterwards, in PG there is no need, and after in life there is no need of competition at all. So simple, be creative, and simple, different and better will serve the purpose. Then the next is the community medicine. If you feel like time something, you can tell me anytime. Community medicine. Everybody, what I feel, is forgetting this part because the knowledge comes from the USA or UK. Every new thing, whatever slides were shown to you, that is very essential and we must learn that. But that comes from Western countries where the population is very small. But in India, the population is very, we have a very high population. Means together, if you count all the United Kingdom, America and other countries together, also our population is very high. So, we need to think about something different. We always think that, okay, 1:1 patient, that is the only clinic. But we should, every field should have a community wing. Every private practitioner should have a community wing. That is very essential. And if you don't have that, how it will not help you. You go for outreach programs or camps. People, I have seen that they give 40% to the managers or what they call marketing managers or something, and then they distribute it to the doctors as a cut practice or something. I better tell you, it's better to go for outreach camps. Even if you are orthopedic surgeon, you can go for backache and osteoporosis and so many other things which you can treat there. And patient will have a rapport with you and they will come to you. If you don't have a time, you can have a team members of paramedics which can go there. But a community wing is a part of a private practice. Has to be. Always think of something different which others are not doing. Everybody thinks that okay, वो वहाँ पे marketing manager उसने भेजा, उसका सबको मिलता है डॉक्टर्स लोगों को, इसको मुझे भी भेजना. नहीं, we will not do that. We don't want to go for unethical practices. Then preventive medicine, that is also very important. I shall share one my experience with you. I had been to camps in Gadchiroli and tribal areas and very deep tribal areas where the language is different and we needed interpreters and there was no electricity and something like that. Once I went to a Toli, that was a small 17 families were staying there, and we went there and I met one of the young person there, and I asked him, because it was remote inside the district, some clinic may be nearly 150 kilometers away from that place. So I asked him, if you have any medical problem, who treats you? He said that we have a Vaidya here, he treats us. The next question arose in my mind automatically was, how much do you pay to that Vaidya for the treatment? He said, we don't pay anything. We pay grains at the end of the month to the Vaidya. We pay grains. I said, suppose you have a diarrhea or a loose motions, how much grains you will give to the Vaidya? He said, no. If I have a loose motion or a diarrhea, in that month, from my family members, okay. If I have a diarrhea or loose motions, then in that month, from my family members, there will be no grains given to that Vaidya. मैं उसको कुछ भी अनाज नहीं दूंगा जब मैं जिस महीने में मुझे लूज मोशंस या डायरिया होता है. तो आप समझ लीजिए, what is the responsibility of a Vaidya or a doctor? That everybody should remain healthy. That is very important. Today, everybody gets benefited if you have a disease. Everybody, a doctor, medical shop owners, medical industries, everybody gets benefited if you have a disease. If there is no disease, I think if some drops or some injections or some vaccine is there for cataract, ophthalmologist future will be in dark. So our system is totally on patient basis. We want a normal, healthy individual. You think that you know and you are taking proper care. Do you know the value of a human life? Do you all know the value of a human life? So will you take vaccination if necessary? Have you taken corona vaccine? All of you must have. But I tell you, this is not the way. I tell you, how many of you have taken vaccine? Even just now, cervical cancer vaccination is available. How many of the girls have taken that? How many of you have taken a booster dose of diphtheria, pertussis, tetanus? How many of you have taken the booster doses of measles, mumps? How many of you have taken of influenza? Influenza? Pneumococcal pneumonia? Deaths due to pneumococcal pneumonia, do you know? What is the percentage? How many of you have taken that? How many of you have taken hepatitis A, B? B is given because in the hospitals they make it compulsory, otherwise no. Outside if you ask, nobody will say no. Everybody will say no. I don't remember the names, but the list is very big. But though the doctors, we are not taking preventive steps because the economy of that is not well developed. Nobody is benefited when you are vaccinated. We pushed corona to a great extent and marketing was done to a great extent and money was thrown in marketing to a great extent. That's why we could get vaccinated. But no other vaccine is taken by the adults. So it's not in our mind still, of the doctors also, that prevention is a necessity and we have to enforce that, and it can be part of the private practice. Who says that? It can be. You tell people that these facilities are available. A gynecologist can say, yes, we can prevent cervical cancer and you can have this injection available to you. So, next. Something different, simple, different and better. Why no to cut practice? People, the doctors will say, we are benefited, we don't get so many surgeries at all, so it's better to pay the practitioners, they send the patient and then we earn. But I tell you, it's a trap. If you have done post-graduation or if you have not, then you will be practicing till the end of your life. It's a long run. So think of a long run vision. That suppose if you do a practice and a private practitioner sends you a patient, what will happen? They usually ask you to charge him more because then they get more. So they provoke you to charge more. Secondly, they will send the patient to another doctor when you are paying less. Thirdly, you lose the faith of the patient. And in a city like Solapur, after 2 years, everybody knows that you are involved in cut practice. So ultimately, in long run, patients will not like to come to you. It spoils your reputation for the life. It becomes very difficult to change over that perception. And even if you treat the patient properly, if he doesn't have faith in you, he will say that he has treated it not properly and I must sue against him or he must beat the doctor or something can happen. So it is better always to treat the patient and not to go into the cut practice and go to the community, go to the preventive aspect, have something which is simple, different and better, not involved in all these cut practices. Next. Use of technology, I think you know so many things, but still in community we are lacking for the use of technology. Just now e-Seva and everything about the government projects are there and they are very well managed, but how many of you have used it? Rupees 300 are given to the consultant of a professor of a medical college, but I know that that is not utilized still in medical colleges. बदल क्या डॉक्टर यूज होता था मेडिकल कॉलेजेस में? हाँ? The e-Seva portal is there. If that is used, you will be paid 300 rupees per patient. But it is not used. You are not aware also. So that is the thing. So why not a private practitioner can do that? He also do. But the private practice, when you do, you will forget that. You will forget, only remember other things, what others are doing. So use of technology, e-Seva, telemedicine, then dermatology, suppose, even in ophthalmology, telemedicine is a very good way. Because if you see dermoscope is there, you will take the photograph, any ophthalmic technique, any technician, 10th pass girl will be better because of photograph. If a girl takes it, there is no objection. She can send it to the doctor and they can diagnose, they can treat and earn the money. So there are multiple ideas how to earn, but with moral values and ethical values. There are patients also will get benefited because to and fro of the patient and consultation charges. If you are taking consultation 500 rupees, he has to pay nearly 1000 rupees to and fro because somebody will accompany and a full day of salary, his salary or his earnings. So that is beneficial for both community and the doctor. So don't think that your practice is roaring doesn't mean that community has a burden. No, community also gets benefited. Next. Role of IMA and other professional institutions to help the beginners. I tell you, if you go to Mumbai or other big cities, I don't know, in Solapur there must be corporate hospitals. These corporate hospitals will hire you, and once they hire you, they will say, okay, such much, this part is the salary, and per patient, if you do the surgery, such a percentage and everything is there. And then after 3 months, they will come to you and then say, no, your surgical advice is very less, so we are kicking you out because we want money. So the financial targets are given to the doctor, that in a month at least you should bring, suppose, 5 lakhs of rupees to the hospital. These are given. But our institutions like IMA and other institutions, ophthalmology institutions, they are not doing anything. If they do, go to the press and tell that this hospital is giving financial targets to the doctors, and which we feel that it is commercializing and it is unethical because he has to advise surgeries more. So this news itself will bring down the credit of the corporate hospital. So they will be afraid of doing that. So these are the things which can be done by these bodies, associations, so that those newcomers will not have to fight for this unethical ways of doing practice. Next, work with government. It has been elaborated by Dr. Maleshwar. I will not go into it. But a private practitioner should have association with the government. It increases the number of patients and it increases your skill. Secondly, you can have associate members, a junior doctor. If you are senior, you can have a junior doctor with you who can do these surgeries. Means of course a skilled one, but you can perform these surgeries or any other things. So always try to utilize the government projects, part of the project, part of the services. The MJP is a very good service government is providing, and I think it's you get money instantly. You don't it doesn't delay also. So always try to get associated with work with the government. So many things I have told you, but I tell you at the end, it is always with ethics and moral values. मैं सबको बताता हूँ, मैं पॉलिटिक्स में हूँ, being former Rajya Sabha member, I am in politics, but I don't say. मैं आचार्य विनोबा जी भावे का एक है, वो कहते हैं कि नैतिक लोक नीति. It's not राजनीति. Once we say राजनीति, all tactics and all the games start. But here it's a naitik lok niti. That is very important, and that's why you will never say a breaking news from Dr. Nagari. It will never be. So it is the ethics which is very important. And I told you, what is important in life is not taught. But if you start taking efforts, you will be a learned in those also. Thank you for telling me. मुझे यहाँ बुलाया, बहुत अच्छा लगा. If a calf sucks the cow and gets the milk, who enjoys more, calf or the cow? बछड़ा यदि गाय का दूध पीता है तो किसे आनंद ज़्यादा मिलता है, बछड़े को या गाय को? किसको मिलता है? हाँ, गाय को मिलता है ज़्यादा. दोनों को मिलता है लेकिन गाय को ज़्यादा. मुझे आप लोगों ने यहाँ बुलाया, आप पूरी टीम ने मुझे यहाँ बुलाया, मेरे व्यूज शेयर करने का एक अपॉर्चुनिटी दी आप लोगों ने, और मेरे व्यूज शेयर करने की अपॉर्चुनिटी दी, इसलिए मैं आप सबको वो आनंद दिया, इसलिए मैं आप सबको धन्यवाद देता हूँ. थैंक यू वेरी मच फॉर द टीम. दिस इज माई email, but you may not write email. The phone numbers are there. Both the numbers are in my one mobile only. But many times this 99755 doesn't work, so write down the other one. If you take out the computer, that will be better because it's not visible. Please do not give a ring. Just text me a message. I don't see the WhatsApp. Text me a message that you are so and so, so that I shall save your number. And anytime, if you feel whether I should inform me or send a message or not, always send a message. And if you have any problem not related with your clinics, not related with medical, anything in the life, I am ready to help if it is possible for me to help in that. And this is my number. Thank you very much. Next. The music is not there, but still you can enjoy. Thank you.
I thank Dr. Mahatme sir for his inspiring words. I request the Dean of the Institute, Dr. Sudhir Deshmukh sir, to please felicitate Dr. Mahatme sir.
Thank you everyone. We are concluding this ceremony by saying this, that whatever the chief guests have said, we must all try to implement it in our lives so that we could enrich not the lives of just ourselves, but also we could lead to the development of our nation. Thank you so much. The bone densitometer which has been arrived in our health camp, it is open for one and all. So you can all just go and get checked your bone density over there. Thank you so much.